Just like the water symbol.
Oh, I don't know about that. Okay, so knee. If we look at the knee guidelines, these little orange blue boxes I've put in your notes. I've just taken little parts of the knee guidelines to highlight. This is something that is recommended, okay? So manual therapy is recommended alongside therapeutic exercises for hip and knee osteoarthritis. So we can be looking at patellar mobilisation. We can be looking at tibiofemoral mobilisation. So with the patellar mobilisations, we talked about if you're doing a cordad glide, it may assist knee flexion, because as you flex the knee, the patella needs to extend down into the trochlear groove here. Medial and lateral guides, while they don't not necessarily direction specific for knee flexion extension, mobility of the patella can assist knee flexion extension movement. So if you have someone who you've assessed has got a stiff patella and they have knee osteoarthritis, it can be a good adjunct. It can also be if someone has had total knee replacement or knee surgery, can be a really good technique to help assist get their knee moving again, so dealing with post-operative or immobilisation stiffness. So if they have one, yeah, definitely. And was it you that was saying you had a patient who had a patella fracture? Who was that? You had patella. So people that have patella fractures, fall onto the knees, broken their patella, so K-wire or immobilised in a splint, very stiff through their patella when they get started as well. So yeah, very, very useful for those clients as well. I'm not going to spend a lot of time on patella. We went through the mobilisation essentially and when we were talking about the assessment techniques, but just to remind you of a few things. With the mobilisation, the medial glide, you're trying to glide across the top instead of tipping like with my thumb on the lateral surface too much, so it creates actually a tilt up that way. So I might be mobilising, but I'm actually going like this with the patella there, okay? So your direction of force needs to be across the top of the patella. I stabilise with my hands at my palmar surface and do this sort of movement with my thumbs, okay? So it's just across. Stiffness, what grade or in a range do we need to be at? End range always. So if you're dealing with stiffness, you have to take up the initial movement of the patella and then you're applying a glide, grade 3 or grade 4. Now you can do these techniques in side lying. I'm not going to teach that way, it's not how I practice, because I find it harder to control the tilt component. To do a cordad glide, bunching around the top of the patella. So instead of holding with my fingers, I'm holding the patella in the web space of my hand. Then I get to control whether it goes medial or laterally with my finger and thumb, and going along the line of the femur to mobilise instead of compressing down again. So if you know that your arm is along the line of the femur, then you are not going to be pushing down onto the patella and compressing the undersurface, okay? So medial glide, you can also do a lateral glide. Clinically, I don't seem to need to do this much, but it's exactly the same, it's just the reverse. So now I'm palpating laterally with my thumbs. We're talking stiffness, so you're not talking about a hypermobile, unstable, dislocating patella. So my range of movement again is still towards that end range of movement. It has to be for a stiffness condition. And then I'm using my fingers to do that lateral glide. Does that feel comfortable?
Sorry.
So just take care if you do practice this on each other. If your partner has got hypermobile patellae or patella alta, just be gentle with them. But you need to be at end range to affect that. Okay, so patella, caudad, medial lateral. Cephalad I don't necessarily find particularly helpful because the length of that is dictated by your patella tendon length. Okay, but if you find that you need that for some reason, there's no reason you couldn't mobilise in that direction with the same protocol of keeping your arm in parallel to the tibia. So if we're doing knee flexion extension, we've talked about this already, you always need to work at end range. So if we're talking about knee extension, we need to be at end range knee extension. Now of the two directions, flexion, extension is the one you have to try and get. That is going to be the most functionally limiting and also create potentially pains in other areas, as in someone who can't extend their leg is essentially walking with a leg the whole time. They're walking with a leg length discrepancy. So you're going to start to get load in other areas, whether they start complaining of back pain or hip pain or pain in the other knee. So knee extension is the one that we really, really want to work on. Okay, so we talked about our concave convex rule. We've got our convex and our concave surface, and we have already said if you want to do knee extension, tibia would be moving in the direction of movement, which is up, right? So it would be this way. Now, you can use your hands, obviously. You can also use a belt. I think I've got that on the slide. Now, there are many of you who are more Mulligan trained than I am. Who are more Mulligan trained than I am. I have picked and chosen bits of Mulligan and bits of using a belt that I feel that have worked for me. You're Mulligan trained, you can fix that up. You can make that work. Okay, so for an APA of the tibia on the femur, you can use your hands like we had, or you can use a mobilisation technique with the belt to give you a bit of extra. Now this is a nice one because knees are stiff, right? But the important thing is you're not pulling them up into knee flexion, because we have already said we don't want, we want to work at terminal knee extension for them. So it's really important that you stabilise the femur and that the belt is up close to the end of the knee, of the tibia, proximal tibia. Also just be aware that you're moving the whole tibia so you can support through the distal tibia as well. Yep. So obviously you're not going to do this when you practice on each other on someone who has knee instability. Just be mindful of your partner and their knee history. Okay? So nice and firm technique, and it doesn't require a lot from me. I'm just using my legs rather than using, if I do this way, which I can do, it's just a lot of work through this arm to do PA in this position. Alternatively, you can work on doing an AP of the femur. So you need to have the tibia supported so that you've got some room to move with your femur in a posterior direction. Does that make sense? And again, this is easier for me because I can get my body weight over, hold at end range, and then I can work at a grade 3 or a grade 4 there. You can do, can I just get you to flip over onto your stomach for a moment, Luke?
Sure.
You can do a PA on the tibia in prone, but it's difficult to get. So for that, you've got to be able to have them in their knee extension, which really almost need to be here. So I find that if you have them on the bed like that, they're not necessarily going to be at their end range knee extension, and you'll have to see if that works for your client, if you find that the most effective way of doing it. There's nothing wrong with doing that as long as you are at end range. Onto your back again for me. So, the 3 techniques for your knee extension. Then, knee flexion. So remembering tibia moving in the direction of movement, and the position of your hands has to be along the line of the tibia. So you're always perpendicular too. Now you can do, with your handling, sorry, I think there's a slide, I've pinched this one from Grant for your scene next week. So, just be mindful of your hands. You're not looking at compressing that second one. Sort of looks like compressing the joint. You can push with your hands like that on the tibia, but remembering you're going on that line here, so still be mindful of that. It's not a squeezing the joint together, so be mindful of your technique. It looks sort of like you're squeezing. So you can either do like this, A, P of the tibia on the femur. You can do this compressive, but what I am doing with this on the tibial tuberosity, gliding along the line of the tibia. So in that position, stabilise and mobilise along the line of the tibia in that position there. And then you can also have the belt like this in that position of figure 8 around their foot to help. Wait a second. Is that long enough for you? So they can help pull into extension, into flexion as much as they can, and you can do an active mobilise with movement in that direction, or you can just go to the end, maintain that pressure there, which assists me in getting an end range movement. Okay? But if you want to do it as an active movement, so from here, flex your knee and pull, and I'm giving a glide, and then a little movement away. Flex your knee, pull, and move away. But with that, it only has to be a very small range, because obviously you're not going to get the benefit from this part, it's this part. So it's just relieving it off and then adding the glide back on. Okay? So let's play with those. Sorry, I just want to check I've covered off everything I wanted to do. Yep, okay, so everything along the tight line of the tibial plateau in the direction of the movement into stiffness. End range, firm grade 3, 4 techniques to get some passive increase in range. Okay? All right, let's go.